Hello, and thank you for joining today's webinar. We will be starting in 3 minutes. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. The speaker and planning committee members have disclosed no conflict of interest. To receive contact hours for this C&E session, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message or question through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. To test out this feature, please submit the state or country you are from. We would like to thank Sigma and CUSIN for today's collaborative webinar. We would also like to thank our speaker for sharing her expertise with us today. Our speaker is Dr. Esther Gravis. Dr. Gravis has been teaching nursing students for the past 10 years. She has earned a doctorate in nursing with an emphasis on educational leadership. She has experience teaching a variety of nursing students in California and Oregon. She enjoys teaching and sharing her expertise and knowledge with nursing students. Now let's go ahead and get started with today's presentation.
Thank you. Hello to everyone. I am going to get started here. All right. So I'm going to review the objectives for today. I also encourage you to post any questions that you have. And I'm going to try to make this as fun, as interesting as we can. And we're going to do a couple polls and just try to make this fun and enjoyable for you. So the objectives today include to focus the student to view the care they provide from the patient perspective, recognize at-risk students and potential behaviors to evaluate, and outline the clinical day and examples of meeting required clinical hours. Let's see here, I'm trying to get to the next slide. I'm having a little trouble getting to the next slide. There we go. All right, so an introduction from me. My name is Esther, as they said, and I've been teaching for 10 years, and I've been a floor nurse for 15 years in California. I'm a member of the CUSIN task force focusing on clinical practice, and I have found that clinical teaching is very rewarding and impactful. I've also found the first day of clinical to be especially stressful for nursing students, and I hope through this presentation you're able to find some good ideas, some suggestions, maybe some fun that you can have with your students during that first clinical day. All of you are teaching different courses, and so I'm hoping that through this you can have plenty of ideas and things that you can add to your course, because I realize some of you are teaching fundamentals, some of you are teaching junior and senior students. And I hope that through this you're able to add a couple of suggestions and ideas to your regular clinical practice. So for some reason, when I click next, the slide is not advancing. Okay, so here we go with your first question. Here's a poll. So if you could participate, we're going to try to make this fun. So during your orientation day, you ask your students what objectives they would like to accomplish while at clinical. How do you know which objectives are appropriate for this clinical course? So if you could answer A, B, C, or D, here we go. Here's your poll, and answer the question. So the question is, during your orientation day, you ask your students what objectives they would like to accomplish. So how do you know where the objectives are? Are they in the course syllabus, in the student handbook, by reviewing the policy and procedure manual, or by asking the nurse educator on the unit what is appropriate? So I'll give you a minute here to answer this question. So if you can say where the objectives are found. Okay, great. In the course syllabus. There is actually a reason why I asked this question. And if we can go to the next slide. The question is important because I have had nurses tell me that students need to know how to immobilize a potential neck injury patient, or that students need to know the signs and symptoms of sepsis. And yes, I agree, these are all really important. However, you have to be able to teach from the objectives of the course. And so I just encourage you to know where the content can be found and guide students to that specific content for the objectives. Okay, so focus the student to view the care they provide from the patient perspective. I find this to be difficult with fundamental students because they're so focused on tasks. So this time that you spend with students in the clinical setting is valuable and an experience students cannot get from the lecture setting. If you're familiar with Benner, she wrote that theory offers what can be made explicit and formalized, but clinical practice is always more complex and presents many more realities than can be captured by theory alone. So each of us have our own memories of nursing school and how it went and what our clinical instructors were like. And so I hope that you're able to take those positive learning experiences from your past and combine them with positive learning strategies, maybe even find a mentor or a peer that you can work with to make the clinical experience not only better for students, but equipping them to be better nurses. It's important for students to be able to develop their own skills, and it's really important for them to be able to reflect on their clinical day. So you can ask students what went well, and they'll often say, oh, I communicated well, or I did a good dressing change. But when you get down to the basics of how did you do that, it's often difficult for them to articulate what happened. And because of this, it's very important for us as faculty to be able to give students time to reflect on what they've learned and then to add to their own clinical practice. I am having difficulty advancing to the next slide. Thank you. So appraise and critique the student's critical thinking. It can be difficult to do this, especially on the first day and with a short course. And so I'm going to give you some ideas here, and I'll discuss it further as we continue on in this webinar. As a clinical faculty, you have to use your time wisely while in the hospital. And so you're often spending time doing dressing changes and IV starts and caring for patients. However, you have to appraise the ability of the students to be able to critically think, or to use what Linda Caputi calls clinical forethought. And this is done by a systematic process to evaluate the student and to allow them to recognize their own error. I've highlighted here in the middle the steps that Linda Caputi discussed, referring to students being able to use clinical forethought. And the first is notice. And so this is the student's ability to gather data. So is the student on time? Do they have their paperwork done? Can they tell you about the patient they're caring for? So can the student use clinical forethought, meaning can they gather data to care for the patient? Do they know what the medications are? The next step is interpret. And so this is making sense of the information. The student may not have realized that some things are necessary to care for the patient. And so you as a clinical instructor have to provide them with information, but allow them time to think about what they need. So regarding oxygen setup or a suction canister, are they able to gather that information? The next process is respond. This is taking action. So this is carrying out the plan. Can the student care for the patient? Are they able to do what you've asked them to do? And then the last is reflect. And I'm going to talk a lot about reflection with nursing students. It's important that the students have time to reflect on what they did. How did it go? What did they do? And I'm going to give you suggestions on using cues and competencies to help with reflection. So this is Dr. Linda Caputi's example. I find it great to use with junior and senior students. So this is a great way on your first day of clinical. Say, I know some of you don't get to do patient care on that very first day. So this is a great way to get them critically thinking without even seeing a patient. So they can look in the patient's chart, describe a brief description of the patient, a brief description of the illness, an impact of the illness, and what the nurse might do. This is called an impact of illness paper. Then have the students write out, as a result of this activity, I have learned how to, or this activity gave me insights into communicating or caring for my patients. I gave the example of chronic kidney disease, but this could be used for any pediatrics or OB or anything. This activity shows that I have learned more about, or this activity shows my growth because. This is a great way to start your clinical practice. I don't find it as effective with fundamental students, but it's a great way to add to your first day with your clinical students. Okay, we've got another poll coming up here. It'll take just a minute for it to come up. And the question is, do you currently work at the facility you are teaching clinicals? So I find this interesting because I have taught at hospitals where they did not allow you to work and teach at the same place. I have taught at hospitals where they expected you to teach and work at the same place. So I have some comments about this once we're done, but if you can put in your vote here. Do you currently work at the facility you are teaching clinicals? Either yes or no. No. Okay, so just a few of you do. 30% of you do currently work. Okay, and 70% of you don't. Great, thank you. So this is important because you are now employed as the faculty member of the nursing school. Oh, get to the next slide here. Trying to get to the next slide. Thank you. Yep. Okay, so this is talking about if you're working at that institution. So you're now hired by the School of Nursing. And so for those of you, that 30% of you that work at the facility, this can be difficult. So it may become increasingly difficult for you because you're employed as a nurse at the facility as well as the school. So nurses working on the unit might ask you to administer a medication or call a doctor. They may think that you're not very busy because you're teaching. And this is a misconception of the clinical instructor. The work you are doing is actually very important and takes a great deal of skill and work, and you may need to balance your time between students and their needs. With that being said, it's always good practice to help the staff and befriend them. So for example, if my students are done with morning rounds, I will ask them to help with morning care of the nurses. But you have to really be careful when you're balancing your time between the nursing staff and your students, because your first priority needs to be with your students. So recognizing at-risk students. This can be difficult, especially on the first day. So at-risk students can be sometimes difficult to identify. For some of you, though, these students have maybe been in the School of Nursing and you're getting them at year 2 or year 3. Also, I've worked at institutions where students are in the skills lab for 6 weeks first before coming to the hospital. And a few basic ways to assess your students are, do they have completed paperwork? Are they timely? Are they dressed appropriately? And this is also a good time to look at the final evaluation. So your institution may call it something else, but these are often preset objectives for each course, and you'll need to make sure the students are aware of these. It's time to not only ensure students are able to complete tasks, but also to critically think. So we have to remember that nursing is not just about completing tasks, but about the art and skill of nursing. And many times the students focus on the task and forget about the care, the human part of the patient. So students, remember, are learning a brand new language. Nursing is a new language, and you have to evaluate their professional behavior by how they speak to the staff and the patients and other students. And you may also notice unprofessional behavior in post-conference. I've seen this, students using their phones or speaking negatively about the staff or even using vulgar language about patient care. Students need time to reflect on their critical day and have time to remediate and to demonstrate these improved skills. So be as specific as you can when providing feedback to students. You might even think about letting the student write down their own remediation plan. I have found that to be really helpful. And you might rephrase the wording of the evaluation. Instead of saying you gave the nurse missing important information or you missed important information, you might say, how would the nurse want to receive information? Or how did you use SBAR? So what improvements do you want to make throughout the day? It's important to make this a positive learning experience for the students. The last thing I had on this slide is about correcting students in front of the staff. You have to be really aware of this as a faculty member, that the staff are watching you and they're watching you interact with the students. So if you can, try not to correct the students at the nurse's station or in front of a patient or in front of other students. But instead find a quiet place that you can ask the student, what went well? What do you want to change for the next time? I find that sometimes students feel critiqued, and if you give them time to answer the question, they can see that they've done some positive things as well. So here's an example of an outline of a clinical day. So for some of you, you've never taught clinical at all. And here's an outline of the day. You would do pre-conference, which is often very short, meeting the students, maybe giving them an assignment that they have. Then you go on the floor and get report and have med administration, maybe physical exams, especially if this is a med surg class, transporting patients. But you also might be asked to participate in simulation as well as skills lab. And so I've given you some examples here of debrief questions. So no matter whether you're doing simulation or skills lab or you're doing a clinical day, it's really important to have a debrief or a post-conference. And these can be emotional times for students. I know as nurses, we often think, oh, it's not a big deal that a student did a dressing change. But if it's their first dressing change, it may be very important to them. This may be an emotional time for them. And so it's important that we have post-conference, a time for them to debrief, a time for them to critically think about an incident. And so I often ask them, tell me more about the situation. Tell me more about what you learned. What were you thinking when you did these things? This is a good time for you to really learn from the students and reflect on their practice and let them reflect on their day. I really encourage post-conference, especially on that very first day. So here's an outline of a clinical day, starting at 6:30, whatever time it is, doing a pre-conference. This is just a mock example of a clinical day. So I encourage you to challenge the students during this first day. I've seen students, when challenged, go beyond their normal function. I have seen students walk on the floor completely nervous, and they're in the middle of a code, patient's coding, and the students are there to help. They have brought in a crash cart, they have brought supplies. And what I don't like is when faculty use this as just a day to review objectives, to meet and greet, and then go home. I really believe that if you push students and expect the best of them, they will learn, and that first day of clinical will no longer be a passive learning day, but it's a way to set the standard for the course. So here's an example of a potential orientation day. Beginning, get to know the students, and then moving on to, I don't know if you have computer training. I'm going to add some things in here about making it interesting, maybe have lunch and then review glucose checks. Maybe they go to the floor. Maybe you do the learning activity that I had already suggested from Dr. Linda Caputi. And then at the end, do a post-conference. Again, maybe you're doing a 12-hour day. But I want to give you an example of how I like to have students introduce themselves or introduce each other, because I find that they're very nervous. However, we do know that those who are in clinical together form a bond and a relationship together that you would never have anywhere else. So one thing I like to do is have students introduce each other. So I get students in groups of 2 or 3 and have them ask each other questions, spend 5 or 10 minutes. Why do you want to be a nurse? What brought you to nursing? Something interesting about yourself. And then they introduce their partner or their friend. They're more likely to participate this way than if they had to introduce themselves. I find this to be a great way for students to interact on that first day. I then move on to whatever training it is and policies and procedures, but I find it to be a good start to the day. Okay, so breaking up monotony of that orientation day, sometimes it can feel so long. So one thing I've done in the past is I've gotten upper classmates to come to that first day of orientation. And this might sound kind of difficult, but I'm telling you, it is worth the hassle. So I email students that had attended with me or at that same location from the previous semester, and I asked them to come to orientation day for maybe an hour and share information about what they learned about the facility, what they learned about the nurses, maybe about caring for patients that semester. And it's amazing to watch upperclassmen just by one semester sharing their thoughts, feelings, opinions with students. They can get more information out than you could in 2 hours. They're able to do it, and the students like it. They like hearing from upperclassmen. I have found this to be well worth the work. Really, especially if you have a student nurses association on campus, they will definitely help you get upperclassmen. This is important if you're a new faculty member and you've never taught at this facility before. I find it to be very helpful. Going to the next slide here. Okay, keep your expectations clear with the students. I just went over about how nursing is not about completing tasks and it's about the human aspect. However, with that being said, if you as the faculty member expect head-to-toe assessments done by 9 a.m. and charting done by 10 a.m. or whatever it is, make that very clear to the students. Students shouldn't have to wonder what time something is due or wonder what time they should do something. Be sure that your expectations are very clear with the students. Okay. Try to make it fun and stimulating throughout the day. I've done a couple of these. Actually, I've done all of these, but this in particular has been a lot of fun. I have the students do a scavenger hunt, and it might sound really easy and simple. Things like what's in the clean core, where's a wheelchair, 4x4s, 2x2s, oxygen masks. Because as nurses, we spend a lot of time looking for equipment. Well, let them go on a scavenger hunt. Find this stuff for themselves. What did they find? How did it go? It's a great way for them to get to know the floor and the unit, as well as what are the codes into the rooms. So a scavenger hunt's a lot of fun. This next one I have found to be a lot of fun as well, and it's to make an escape room. You can actually Google this. It's pretty easy. It works better at the school unless you have a room that you can use at the hospital. And if you've ever done an escape room, it's a lot of fun. So you can put on Mission Impossible music, have the students in a room, and you've essentially made everything wrong, right? The oxygen isn't set up, the IV is at the wrong rate, there's food underneath the patient, there's pills on the counter, the side rails are down, whatever it is. And then they have to find what's wrong. And often, for example, they could put together a puzzle. You put puzzle pieces together and then they put it together, and when it's done, they get out of the escape room. So it's fun, but it's also educational. And I have found escape rooms and these scavenger hunts to be a lot of fun and interesting for the students. It builds camaraderie, and also you're able to meet the objectives for that day by having them do these fun activities. Another thing I've done is I've made a social contract with students. I've done this in my lecture setting for a while, and I've started doing it in my clinical as well. A social contract is a contract that you have with the students, and oftentimes they hear this term and they think, oh wow, that seems really serious. But it's not always. And I often start the conversation. So a social contract that I have with the students is, if clinical is canceled, I will contact them as soon as I know. If they have paperwork, I will return it within 1 week, things like that. And then I let the students start talking. And these are actually examples that have come from social contracts that my students have come up with for each other. They want to be on time. They want to encourage each other. They want to make everyone feel welcome. They don't want to be interrupted. They want help if they ask another student for help. So I write down whatever it is that the students suggest, and they often come up with vital important suggestions for each other. And then I will type it up and I'll post it to whatever it is that we're using, whether it's Blackboard or whatever it is that we're using within our clinical site. I have found social contracts to be really helpful for students. They keep each other accountable and they keep us accountable to them. Let's see here. Okay, so some of you thought you were teaching clinical in a hospital and then found out, no, in the fall, that is not the case. You will now be teaching online. So I've inserted this on online clinical courses because due to the changes, whether it's COVID-19 or your hospital isn't allowing students for whatever reason, schools don't have as many clinical placements. We now have a lot more hybrid classes. So maybe a few weeks in the hospital and the rest is simulation and skills lab. You might be 100% online. You might be doing what's called clinical in a box. So in this case, students are sent a clinical box. So it's got an NG tube and a Foley and syringes, a whole slew of things that they would use in the hospital. And then they have to watch videos or maybe make a video, and then they have to demonstrate for you the ability to use that equipment. So that's a little bit different. Sometimes they're asked to do online modules. In mental health, we're doing more of this, where they do online modules and then they're asked to do group work. Maybe they have to do on Google Docs or a PowerPoint slide, and then they'll submit it to the instructor. So online courses have changed quite a bit just in the last few months as well. So you, as the clinical instructor, you have a job description as well, and it's a good idea for you to learn about the hospital. Go to the hospital, meet the nurses. What is it like at that facility? Do you have a break room? Do you have a room for post-conference even? Do you have a room that you can do an escape room in? Remember that students are a protected population. And I say this because you as a faculty member have been around nursing for a while. You know that some nurses are difficult to work with, and students at times can be placed with difficult nurses, and I don't find that helpful for undergraduate students, if possible. Remember that students are a protected population, which means students can't go to their supervisor. You are their supervisor. They don't work for the facility. And so we have to protect students to ensure that they have a good learning experience and that they get the opportunities that they need. With that said, you can't always avoid difficult nurses, but please remember that it's your job to enrich their learning process. So, job description, you might also be asked to grade papers or participate in simulation. And for some of you, this is really nerve-wracking. There are a lot of, you can Google simulation. I would do whatever you can as a clinical instructor to learn more about what it is that's expected of you before you get to that point. It's going to help alleviate a lot of your anxiety. So stay engaged when teaching online. I've included this because, like I said, some of you are going to be teaching, and then you might be in the hospital now, and then in a few weeks, you'll be teaching online because the hospital no longer allows students. And what I have found with teaching online is you have to ask students a lot of questions, and I start with a lot of basic things like, do you have an animal? What do you like to eat? And then get into why did you pick nursing, and more of the questions that relate to the objectives, the how and why questions. But what I have found is as you get students to speak and to communicate with each other and to talk about funny things like animals or hiking or whatever, you can jot down some notes about the students, and then you'll review those again with them. You can still have that engaged relationship with students without being in person. It takes a little more time and a little more effort. I find you have to really check in with these students regularly, not just an email blast, but how are you doing? How does this make you feel? Also because some of these students did not choose to learn online, but that is where their schools are going now, and they feel isolated themselves. I know that happened at the end of last term. Students felt very isolated because we were pulled from clinical sites and they had to finish courses online. And so it's important to be engaging students and checking in with them regularly. Next, we're going to show a video made by the Cleveland Clinic. It's an empathy video. We're going to show the whole thing. It's about 4 minutes long. It's going to take a few minutes for it to load. I hope that through this, you're able to add this to your practice and share it with your students as well. Okay, so I am back. I find that to be a valuable video to show our students, other nurses. I try to use it as part of my orientation day. I find it to be so valuable to put perspective into what we do. And then after I show it, I like to do some role playing. So have them now introduce themselves to their classmate who could be a patient, maybe practice physical exam, practice range of motion. Once we show a video like that, I really want them to be able to practice and put into practice what they've just seen. So I hope that even just by viewing that, you're able to implement that video into your practice as well. It's hard to talk after showing that video. Boy, it seems like there's just not much you can say. You have a job as a faculty member. So your job as a faculty member is to understand the program that you'll be teaching in, the program philosophy, the course sequencing. That's really important because you need to know what they've learned, what they're expected to learn, the course content as well as the syllabus, and then expected clinical outcomes along with the faculty handbook. These are things that you need to be familiar with, aware of before the course begins. So I'm going to talk about using some reflection and rephrasing. I talked about using reflection on that first day, your first clinical orientation day. And I've got some examples of what to use, and I use the cues and competencies to help us in our reflection and rephrasing. I worked with a faculty member who would often use reflection directly after an experience that the student had. So whether they give medications, help deliver a baby, she didn't wait until the end of the day, and it was very effective. So they would finish a procedure and then walk out of the room, and she would say, how did the experience of caring for this patient feel for you? What would you do differently the next time if you cared for a similar patient? And I find that if by using reflection early on in the day, it helps the students. Don't wait till the end of the day. Gosh, so many things happen if you're there for a 12-hour day. You might find reflection done in the middle of the day, right after a procedure. So these are just some examples you can use of using reflection, either shortly after a procedure, an event, maybe after you've done simulation, or at the end of the day when you're doing post-conference. So these are reflection used on CUSIN competencies. These have come from the CUSIN website. The second one I want to talk about, and it talks about direct criticism would be you need to demonstrate immediate improvement. So maybe a student's having difficulty, you're there on your first day, and the student just seems disorganized. But instead you could say, what strategies can you use in your practice to prevent this problem from occurring? It's important for the student to not feel threatened when you're asking them what they can do to improve. These are examples that you can use. They're also found on the CUSIN website. I want to also remind you that as a clinical instructor, your work makes a difference. I know sometimes it can become difficult. You can become stressed. You have students you're trying to evaluate. You've got all these things you're trying to do. But the work that you do makes a difference, and it's changing patient outcomes. Ken Burns wrote a book called What the Best College Teachers Do. I think everyone should read it. It's really powerful. But he says it's important to know the content matter to be able to discuss it. He said also expect more of your students. They can critically think if you allow them to. Believe every student is there to learn and provide them with critical thinking scenarios. Don't blame the student if something doesn't go well, and get the student's attention by asking them questions and allowing them time to develop their own responses. I think it's powerful because Ken Bain was not a clinical instructor and was not a nurse, and yet these are the things that we're trying to do. So discuss ways to ensure objective documentation. I know this can be difficult with some students. It's easy to evaluate students differently. Some are just easier to work with. Some students receive feedback more easily. But it's important to be non-judgmental and objective when evaluating your students. And I talk about this on that first day because you have to be evaluating, especially with short courses, you're evaluating them day one. So most likely they have a set end term of evaluations or clinical documents that they have to fulfill. And if you're having difficulty with a student or anytime, it's good to draw the student to those documents, the end goal objectives. Some things that are very easy to measure, like are they on time, or are they complying with their dress code? And some things are a little more difficult to assess about critical thinking. So use the cues and competencies. Use those reflection questions to help ask questions of the students and to evaluate the students. So oftentimes in simulation or in the beginning of the course, you will be giving medications with a student, and it can be common for them to draw medications or to have difficulty with medications. And I use this example because oftentimes we'll use one of these in simulations. And instead of saying to a student, I'm going to give you some CUSIN perspective when we're evaluating students, instead of saying, you pulled the wrong medication, it's unsafe, instead you might say, what would be your concerns for this patient? Instead of saying, you need to be more careful, you might say, what aspects of your patient in the situation would you change in retrospect to prevent this and to provide safer patient care? You can rephrase questions to allow the student to develop their own responses and for them to come to their own conclusions about how to make the situation safer for the patient. You have to articulate the need for prompt reporting. I find this to be difficult for students, especially fundamental students. They don't know when to respond and when not to. So we know that a slight change in vital signs or labs might not be a big deal, but students don't always understand the concept. They either think that anything out of the normal range is a reportable problem. They don't understand gray concepts, or they think that someone probably already knows and it's not a big deal. I give the example that a student might notice a decrease in blood pressure but doesn't tell the nurse for several hours, and then the nurse has medication to give but holds the medication because they didn't know about the decrease in blood pressure or the increase in blood pressure, and then the patient doesn't receive the medication, and then maybe they suffered a stroke because of it, or whatever it is. Students don't always know that they need to articulate a change in patient care. So these are just some of the ways we have to let the students know they have to provide that information to us. And you can ask the questions like, how would you, if you were the patient, how would you want the nurse to care for you? Or what information would you want the nurse to know? And in general, I tell students it's better to over-communicate than under-communicate. Okay, so this is a book that I have found to be very valuable. Diane Billings and Judith Halstead have written this book. This is the 6th edition. I'm just giving it to you as an example. It has a ton of resources for lecture as well as clinical. This is actually the 6th edition. I have an older edition at home. If you are interested more in teaching, teaching lecture and clinical, I have found this to be a great resource. So it's called Teaching and Nursing, A Guide for Faculty. Okay, so I want to talk about ways to lead a post-conference. This can be difficult. I know I've worked at facility or at schools where they expected a post-conference or at least an hour and a half. And if you have a small clinical group, this can feel like a long time. So one way is to have students give report. So for example, they've cared for that patient all day. Even on your first orientation day, they know enough about a patient, they can give report. Maybe you're going to use the example that I gave earlier of Linda Caputi's example. They can give report on that patient, and the rest of the students can write down report and act as if they're going to receive that patient as an oncoming shift. That's one way to lead a post-conference. Another is to play a Jeopardy game with lab values. That's always kind of fun. I've also given you a list of questions to get the students talking. This is a way of getting them to communicate, but also to reflect on their clinical practice. It's also a way for them to learn from their colleagues. So post-conference is a time for them to discuss their issues, concerns, worries, feelings, all these things that they have thought about. But you have to be careful that one student doesn't monopolize that time. So you're welcome to use these questions. I've just written some of these. How would you handle patient care if you were the primary nurse? In what ways did you perform well? And then ask them more about this. Discuss experiences with diverse patient populations. Find out more about what they did. I have found students are a great wealth of information, great wealth of knowledge if you allow them to express themselves and to share that information. We also know that because of HIPAA, post-conference is sometimes the only time students are able to discuss the care that they gave to patients. Here's another example of rephrasing questions. What was one thing you won't forget about today? Leaving these open-ended questions for the students. What can you do to put your patients at the center of care? And really allowing them to explore these questions and to discuss them more. I've included in here also tips on dealing with a difficult student. Although we were talking about your first clinical day, I know that all of us have had students that have come to orientation. I know I have hours late, showed up hours late, didn't have their uniform on, completely unprepared for clinical. And it's easy to take that personally, but the first thing you really have to do is just calm yourself before interacting with that person. Calm yourself down, don't escalate the situation, listen to them, be empathetic. I can't emphasize that enough. Be empathetic to them, listen to them, hear their concerns. I know from teaching previous courses, students often assume that this first day is a wash, that they don't learn much on orientation day, so it's not a big deal. Well, if you are expecting them to be there and you have a variety of activities planned, you want them to be able to participate in it. But also, it's a learning experience, and we know that. We've talked about that. The more you challenge a student, they will meet that challenge. So use open-ended questions, listen to them on that first day. We know that by allowing students to articulate their feelings, they might not understand how important it is, or they might have a lot of other things going on at home that they need help managing. So the Joint Commission has also identified that communication is the root cause of many sentinel events. And as educators, we're in this unique experience to help build and grow a healthy work environment and a safe environment. And so it's important that we are listening to our students, but also holding them to a higher standard as well. I wrote in the bottom here that you could have students even write about a difficult encounter. Sometimes it's hard for them to think of why is it important that they were on time, but if they're able to write about a time that maybe a doctor was late or someone had to wait for a long time for medications, for example, that they're able to understand that what they do affects other people. I've taken a screenshot here of the CUSIN website. On the CUSIN website are a ton of great clinical teaching strategies. And so if you are teaching OB, mental health, med-surg, whatever it is, you can actually use the search bar, search engine on the CUSIN website and find these fantastic clinical teaching strategies. Some of you may have even submitted a teaching strategy. They're always open to that as well. But if you want more suggestions, this is a great place to get more suggestions related to your teaching. Okay, so we're going to end here with another poll, another question. This takes a little bit to load. But is there anything you learned today that will be helpful during your first day of clinical day of orientation? I tried to make it easy for you. So this is a yes/no response. Hopefully there's something, even if it's just the empathy video, that you're able to use and to add to your practice. I think the escape room is a lot of fun, obviously, but any one of these strategies, I hope that you're able to add to your own practice and just add a couple things to what you currently do in your clinical practice. I have left the references in the back, so we're on our last slide, if I can get there. The references are also resources. So for those of you that are interested in learning more about these, IHI has a lot of great information. Center for Medical Simulation has a lot of helpful information for debriefing or assessment tools. Coursera is easy to use. NurseTim, obviously, CUSIN strategies. StoryCare through Laerdal is another phenomenal way if you're teaching online. Dr. Linda Caputi has phenomenal resources for you. So I've just tried to leave for you references and resources for you to use in the future if you'd like. So thank you for attending. Thank you for coming. That's all I had for today. We now have time to go through questions. If you have any questions, please jot those down and write those out. Thank you for coming.
Please feel free to enter your questions in the question feature. Esther, we have a few questions for you. As
Okay.
new faculty to the clinical environment, is it best for my students to receive report from the day shift nurse after he or she receives report, or from the night shift nurse?
Okay. Am I mic'd? Yes. Okay. I find it difficult for the night shift nurse to give report. Oftentimes when the students get there, night shift wants to get out and they don't want to spend the time to give report to a student. So if you can get some information from night shift, that's helpful, but I have not found night shift to be able to stay with students to be able to give them report. If at all possible, I like it if students can wait with their nurse and hear report from the night shift that gives it to the day shift nurse. That's my first priority. Otherwise, get it from the day shift.
Thank you. COVID is impacting our ability for pre and post conferences. The floor where we are lacks a meeting room that allows for social distancing. How do you suggest we meet with them when there is no space?
Okay. I have gone to the school. However, this semester, they may not allow you to do that. At the institution I'm at, we used Zoom for post-conference, and it seemed a little anticlimactic, but we essentially went home and then got on Zoom and did a post-conference. It worked. It's not ideal, but we were able to share experiences, and I found that to be probably one of the best ways.
Thank you. How do I deal with the over-talkative students without being rude and allow all the other students to participate?
So I've done this a couple of ways. I do sometimes have to stop students and say, thank you for sharing. Now let's hear from another student. If this behavior continues, I have spoken to that student that likes to share a lot, and I've actually said that to them. You really like to share a lot, and you have a lot of good information to share. However, it's important that we hear from other students. And it may sound harsh, but I have had positive results from addressing this student that continues to speak a lot. The other thing I've done is before they're able to talk or share much, I will call on a quieter student first, allow them to share, and then allow the student who interacts more or likes to talk more to allow them to speak.
Have you found the ideal number of students per clinical instructor?
That is a trick question. I say that because oftentimes we don't have a choice as clinical instructors. I think 8 is ideal. I think 8 is manageable. We also know that schools have a difficulty decreasing the number of students beyond that due to finances. 8 to me is ideal.
How can students listening to presentations be kept involved?
Oh, so I like to give them a piece of paper with questions on it and not just fill in the blank, but things like questions that I had given in the debrief. How will you apply this to your practice? What is something that you can do if you were the patient or if you were the nurse in this situation? What would you do? I try to use those debrief questions as open-ended questions and have the students fill those out while they're listening to presentations.
What specific resources do you recommend in a pandemic time for clinical practices in a pediatric nursing?
So CUSIN does have a few pediatric examples. Also, Dr. Linda Caputi's examples can be used in pediatrics. I think that this is a good question because pediatrics, just like OB, often gets less time, less attention. So Center for Medical Simulation, I would use Dr. Caputi and then CUSIN, and I would type in pediatrics.
Thank you. How do you fairly grade group assignments?
I grade group assignments in a how can I say, less intense way than I would if they were doing it on their own. Because you always know in groups there's one or two people who did more work than other people. The other thing I do is I have them evaluate each other. And that's private, sent to me. And that's one way to be able to determine who did the most work if they evaluate each other. But I find group work in general gets graded less strict than personal private work.
Do you have any recommendations for online virtual simulations only?
Yes. If you have Elsevier, see, it depends on what your curriculum is. I would use Elsevier. I think Elsevier has some, if that's who you have, if that's what your students are using. Elsevier has phenomenal online simulation, clinical practice videos and online simulations.
How do I engage a student who shies away from participating in discussion at a post-conference?
Yeah, so what I've done with those students is I try to get them thinking about their day ahead of time, ahead of post-conference. A lot of times those students are nervous to speak, they're afraid of what they're going to say, they're anxious. And so I try to give these debrief questions to them before we get to post-conference. Allowing them time to think about, what would I do if I were the nurse? How would I respond to these situations? And if they have some time beforehand to think about what they would say, they'll often interact, and they'll often interact better in post-conference. I will also say to them, I'm going to ask you to talk about your patient when we get to post-conference. Do you feel comfortable with that? Most of the times they say yes. And then I give them a few minutes before post-conference to write out what it is they want to say. And that's been very helpful.
How do I ensure that I am giving adequate time to each student throughout the clinical day, especially if they are working in different units?
I absolutely agree, and I find the best way is to keep, essentially, it's almost like an Excel spreadsheet. I keep a sheet with every unit they're on, and I try to outline how much time I've spent with them. I especially do this with medications. If a 10-hour day is fantastic because you can give meds in the morning and in the afternoon. And then I break up who I have seen morning and afternoon, especially helpful if you have multiple days. Not every student gets all the time that you have, and you have to trust that the nurses on the floor, especially if you know them, will engage the students and get them learning and interacting at a high level. And I'm sure that there are a couple of nurses that you know, and you can say to those nurses, please not only interact with the student, but get them thinking, get them talking. And you might not spend as much time with that student that's a little bit stronger, that's with a stronger nurse. Otherwise, I find that I have to document it. I have to have the student's name and what time I saw them and how long I was with them.
Have you ever had fundamental students work in pairs to care for one patient for a few weeks?
Yes. To me, it's not ideal, but I have. What I don't like is when they become dependent on each other and find it difficult to do things on their own. But yes, especially if census is low, you do, and in some ways you have to. One gives meds, maybe one does the bed bath, and then you switch it up in the afternoon or later on in that day. But yes, I have.
If you have any additional questions, please feel free to enter your questions in the question feature. How do you deal with an overconfident, boasting student who may be a CNA or an EMT?
Yes. Yeah, I have learned from my mistakes in those situations. I don't want them to monopolize situations, monopolize clinical, and continue to talk about how much they know. And what I'm always reminded of is that they are not a nurse, and they do not know what it's like to be a nurse. So although they may be a very good CNA and a very good EMT, they are not a nurse. And you might even have to remind them of that. You are a very good CNA. However, you are not a nurse. And by using the CUSIN strategies of rephrasing, I find that to be helpful. I find that also true with LVNs that are in nursing school, because they are a nurse, of reminding them that they're learning to be an RN and what is necessary as an RN. And sometimes it's the basic things of basic patient care that have to be done. I always go back to those cues and competencies especially safety, of how can we care for our patients as a nurse? I think this is a good question and probably one that we will discuss and struggle with for a long time.
How do we reconcile the idea that real-world nursing is different from NCLEX nursing with students?
Yeah, again, until the NCLEX gives us practice skills to do, there's no way. And unfortunately, students can be very good at test taking and not good at the bedside. And I don't know if at some point the NCLEX will give us skills, will give students skills or not, because I agree with you. And we can't teach to the NCLEX. That's not an entry-level nurse. And yet that is what the students are preparing for, is the NCLEX. So I think it's a great question. I think it's one that we will continue to talk about for a long time.
This question is threefold. First days can be very nerve-wracking, especially for the students. If there's a difficult nurse that calls the student out in front of a patient, what is the best way to address the nurse? What is the best way to reestablish rapport with the patient? And how do we rebuild the confidence of the nursing student?
Okay. I'm just making some notes while we're talking about this. Yes. It sounds like you have obviously had this experience before. So dealing with a difficult nurse, I have found works best when I pull the nurse out of the room if possible to talk with them. Sometimes, unfortunately, you have to say, I am the nursing instructor and I will help with the student. You have to reestablish the relationship with the patient, and unfortunately, it means talking the next shift up, which means talking the nurse up. The nurse is competent. The nurse knows what she's doing. And although in your mind you know that she was inappropriate, or he was inappropriate with the student and with that situation, it does help to talk that nurse up. They're a good nurse. They're competent. They know what they're doing. Maybe they use the wrong language. I've said that before. And then rebuilding the confidence of the student is going to take time. And I find, again, it's a debrief. How did that go for you? How did that make you feel? What will you do next time? If you were the nurse in that situation, what would you do differently? Because unfortunately, these are situations that we continue to deal with, and it's inappropriate for nurses to speak this way or to do these things to nursing students. So I try to be firm as much as I can with that nurse, let them know that this is not it's not acceptable, not something we do, but reestablishing that confidence with the student takes time. And I think it's bold, and I think it's something that we are going to have to do while we're in the clinical setting. So thank you for that question.
So after you address the nurse, how would you reestablish rapport with the patient?
And that's talking the patient up. Okay. So I'm sorry, talking the nurse up. She's a good nurse, she or he knows what they're doing. And unfortunately, you're going to have to say positive things about the nurse, whether you actually feel that way or not.
Thank you. How would you conclude the last clinical day of the program?
Oh, I love the last day. So I love to have students essentially, have them start as they had in the beginning, caring for patients, doing what they do. And then I like to do I call it a popcorn game, and I throw out words and have the students, this is kind of in a post-conference or maybe at lunch, have them say the first thing they think of. So I worked at a school that used ATI. So whether you're using ATI or Elsevier, and I like to say ATI and then what comes to their mind, or I'll mention the floor, maybe that we've been on, a difficult floor. So M2 or whatever it is, and then what's the first thing that they think of. It's a kind of a fun way of letting them express their concerns, or I'll say med-surg tests and then let them say the first thing that they're thinking of. But concluding that that last day, I like to be able to come up with one positive thing at least for every student that you have noticed in that student. The way they've grown, they've advanced, whatever it is that they have done, one interesting thing that they did in clinical. And once you start this positive chatter, they start it too. And when they can start talking positive comments about each other in the room, it's a different type of post-conference. And I like that because it leaves clinical with a positive experience, whether they had one, because some of those days can be very difficult, but to leave on a positive note to me is very important at the end of that clinical rotation.
Esther, we have one last question. I am a first-time clinical instructor, and we have talked a lot about helping students with their anxiety. What tips do you have for my anxiety about teaching for the first time?
Yes, you know more than the student does. You are competent, you are able, you know what you are doing. And I find as a new clinical instructor, your kindness and your patience is what will carry you through this semester. The students don't know that you're nervous. There's no reason to show them that. They know if you care, they know if you're kind, and that will take you very far in this semester.
Thank you so much to our presenter today for this great information. Sigma is grateful that you took the time to share with this audience and look forward to hearing more from you in the future. As a reminder to our attendees, please submit the state or country you are from in the questions feature. We hope you enjoyed this webinar. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Thank you for joining us and have a wonderful evening.